Hello, everyone. This is another Freedom to Feel conversation, and my guest today is Sam Mandel. He's a lifelong mental health advocate and entrepreneur. Sam co founded Ketamine Clinics Los Angeles with his father, Dr. Stephen L. Mandel, in 2014, and has grown the clinic to be one of the most successful and well respected ketamine infusion therapy clinics in the United States. He's also a professional actor, a rapper, and freestyle artist, which I just talked to him off record, put a smile on my face. That's fun. So this is my brief introduction to you, Sam. The full bio will be at the end of this video. So I guess my first question is, what inspired you and your father to do the work you're doing today?
It's a good question. I think a lot of different things inspired both of us. And, ultimately the main were friends and family struggling with mental health and the lack of really meaningful solutions that
Mm,
have been available up until very recently. And we've both, we've lost friends and family to suicide. And I think a genuine desire to help people to heal and to live happier and healthier lives.
yes. Wow. Wow, I didn't know that backstory to that extent. I'm sorry to hear that. And I just mentioned off record also that I went through a lot of issues, having childhood problems, traumas, and not understanding. So it seems like we fail to understand our own being, the way we function, how the mind operates, and even the body a lot of time. So from your perspective, what causes this disconnection or this lack of knowledge of self?
Well, I think that there's a lot of different things going on there. And it's a difficult question to answer, frankly. I don't think there's any one right answer.
Mm,
But I would say that people are not typically accustomed to nurturing and tuning into their inner voice in general in
mm,
life. Their gut,
yeah.
as you could call it, instinct, intuition, and that's a thing that most of us need to consciously develop. And some people are more attuned to that than others, but everyone needs to nurture that part of themselves and
Mm,
reinforce it. And so many people don't. They don't know how. Maybe they don't believe in it. They don't. They've been taught not to, or led in the opposite direction of that, and so there's a lack of
yeah.
awareness of one's thoughts, feelings, of even the physical body. A lot of us are operating in our imagination, our memories of the
Mm,
past, or our imaginings of the future, and not in the present moment. And so it's easy to tune out of what's really going on in the here and now with us and in our lives. And I think that lack of awareness and that lack of connection
yeah.
definitely is at the root of a lot of issues and challenges in life, whether it's mental health conditions or just even a lack of joy because you're never really in the present moment. So you're always either in the past or the future. Some people say that dwelling in the past is
Mm,
depression, and that dwelling in the future is anxiety. And I don't think that either can be summed up so simply as that, but there's definitely a lot of truth in that. I think it's very interesting when you think about it that way.
that is so true. Yes, yes. That was definitely my case being in the
Mhm.
past that made me feel depressed. When I read your bio again, that you are also a creative. So that made me think about the connection between mental health and creativity, imagination. So where is imagination? What would you say it is happening? Something that's happening somewhere in the future, or this is a present moment kind of activity of the mind?
I think imagination is also like a muscle that you can use and develop or not use, and
Yeah.
I think imagination is a beautiful, special thing, and it's the
Mm.
ability
Yeah.
to see into the future or to see things that aren't yet real or don't exist, at least in this realm, and to
Mm.
whether it's real people or real events or real things or things that don't even exist yet in an
Right.
alternate way of existing. And I think that's very
Mm.
powerful. And that's definitely an important part of bringing those things into existence.
Yes, yes. Do you relate mental health to creativity? Actually, before that, Sam, how do you define mental health these days? What is to be mentally healthy?
I think to be mentally healthy is, first and foremost, to be able to, function well with a certain level of stability. What
Yeah.
does functioning well mean? Well, it's a spectrum, right?
Yeah.
But
Yeah.
to be able to live the kind of life that you want to live and to do the things that you need to do in order to be healthy, for your basic needs to be met, for you to get adequate sleep, nutrition,
Yeah.
fitness, hygiene, have healthy interpersonal relationships with other people, and live a full and balanced life. And all of us
Mm.
are working on something. May not have all of those categories down as well as we would like, but to be in the pursuit of continuing to work on them, and to feel at least like we have a certain level
Mm.
of ability to impact the result. When you start to feel out of control, or like it's hopeless, or you feel helpless, or you feel worthless, and like you actually can't really make an impact on those areas of your life or other things in your life that are important to you, and you're stuck, that's when you start to fall out of health.
Mm. That's a very good point. I love the piece of healing, this constant, ongoing process that's very
Yeah,
dynamic. It's not a destination, right, Sam? Even for
yeah,
mental health, nothing's a destination, I feel.
100%. There's times in life when we're out of balance, and that's okay too. We don't, it
Right.
isn't,
Mm.
I think a lot of this comes down to like setting reasonable expectations. And I think we put a lot of
Yeah.
pressure on ourselves. A lot of people do. And I think a lot of people allow others to put pressure on them of certain ways of being or thinking or behaving.
Yeah.
And this idea that we should all be happy and in balance
Yes.
24/7 all the time for life, it's just
Yeah.
ridiculous. That's not how life is. And so if we can let go of that a little bit, I think we can find more joy
Mm.
in the moments of being out of balance, and faith that that's
Mm.
temporary, and it's actually quite fine.
Mm. Wow, I love that. I love that. I have to say it 3 times. That sounds very spiritual to me. I'm very much interested in anything spirituality. And
Uh-huh.
this is one of the practices, really. I'm a student of Vedanta. It's a Hindu spiritual philosophy that they go quite deep. And they do speak of that. So there's no perfection, but presence. Just no perfection, but being here now to what is present, being present to what is here. So that speaks very much to that there's no reason for self-judgment or even to judge others, and or to be scared of being out of balance, as you said. So I guess I'll ask you this question. Gosh, I know I have so many questions here. We will talk about ketamine in a moment, but what is your experience of reality, Sam?
Yeah, I think it's so, it's so broad. There's so many things that come to mind, and it varies. But I would say that my experience of reality is that life is an exciting adventure, and
Mm, mm,
a path that you can create, or that I can create, to be virtually anything that I want, and to bring it
mm,
back to imagination, anything that I can imagine, as long as I can envision it and also apply hard work and focus on it, and that anything is possible, and
yeah.
that my reality is serving a purpose, to make the world a better place and to better the
Mm,
lives of those around me. And one of the best and most significant ways I can do that is to continue to expand in the quality
mm,
of who I am, and
mm.
to grow myself. So I would say that's definitely at least part of my experience of reality.
Wow, yeah, that was a profound one and beautiful and very clear to me as a foundation, especially when you talk about being open, imagination, everything's possible. That's being open. Yeah, and I
Mhm.
think that brings the fun, right? I couldn't really answer that question with some as much clarity as you did. That's really beautiful. Yeah, clarity. You're so open. You're open, and to me, that's everything. That's the beginning of everything. Being open to possibilities. So you mentioned purpose too. That's another question I had for you. I still have it. What is your perspective on that? What's the purpose of life as a whole? Is it an individual thing, personal, or do we have a purpose as humanity?
Yeah, I think that the purpose is a lot of what I shared about my own experience of reality. I think we're here to really just to enjoy life, to be grateful
Yeah.
for it, to experience it fully,
Mm,
to have fun, and also to, yeah, experience happiness and to create. I think we're made
mm, Yeah.
to create. We've been created to create, to be creators, and to create and recreate ourselves and the world around us in positive ways. I think a lot of what
Yeah.
we see in the world, you talk about wars and whatnot, I think there's a lot of destruction. There's also a lot of beauty and creation going on. I hope we'll continue to move more in the creation realm and less in the destruction realm. But of course, there's always going to be some negative forces in the world. And
Mm.
I believe that we should work to make ourselves and the world around us a better place. I think that's every individual's responsibility, and I think that's our collective responsibility to heal the world. The world is damaged and broken in many ways, and each of us can have an impact in ways small and in sometimes quite large, especially when we band together to
Mm.
help heal. And I think that's an important part of what we're all doing here. And of course, it should be enjoyed.
Yes. Yeah. You went back to fun, enjoyment. Yes.
Yeah, that's so, so important because there's no real
Yeah.
purpose to uh, any of it. As I think, just like the notion that some might have that we're here to be servants or just to serve
Yeah.
God or to, I don't subscribe to that. I
Right.
think, a genuine sense of joy and fun and pleasure is
Mm.
what else are we here for if not to really experience life in positive ways, and explore.
That's true. Yes, 1,000,000,000%. Um, that I think being the foundation would change everything, right, Sam? If we take life, if we coming from that place, you mentioned gratitude too, being open, being grateful, coming from a place of creativity and fun, that changed everything. Has been my experience. It really, really did. Of course, I have done a lot of healing work. And speaking of healing, so let's talk about what do you do, you and your father. So, ketamine. What is ketamine, and what is ketamine infusion therapy? I think those are the foundational questions to begin this conversation.
Yeah, those are good questions. So, ketamine is an FDA approved medicine. It's an anesthetic, FDA approved. It was synthesized in the 60s and FDA approved in 1970.
Wow.
And it was among the most widely used anesthetics in the world. And it still is. And in the last 25 years, it's been proven to be among the fastest acting, safest, and most effective antidepressants when
Mm.
used as an IV infusion and a sub anesthetic dose, so much smaller dose than has traditionally been given for sedation.
Right.
It's also a drug that's used in veterinary medicine, so some people know of it as a horse tranquilizer or a cat tranquilizer, and they think it's quite odd or maybe even crazy to give it to people. But the fact is, it's FDA approved for humans, and a lot of medications are used in both, that are approved for humans are used in veterinary medicine as well. So that's actually pretty common.
Yeah.
And it's an analgesic, it's a pain reliever, so it's used in certain situations, maybe instead of opioids, if somebody's gotten into a terrible accident or an injury or something, some trauma.
Yeah.
It's also a drug that people use recreationally, known as Special K and other nicknames. And so people who only know of it because they know a friend who has, done some at a party, or maybe they did some at a party, they think it's so crazy that we would be giving this to people as a treatment. But
Yeah.
and a lot of medicines that have great potential to help people heal can also be used in other ways, and sometimes in
Mm. Mm.
recreational ways. So it's a really ubiquitous drug. It has a lot of different identities, a lot of different uses. And this use as an antidepressant and a treatment for PTSD and anxiety and other mental health conditions
Yeah.
is a relatively newer use for it that's been proven out over clinical research for about 25 years now. And my clinic, Ketamine Clinics Los Angeles, has been providing it for 10 years now. And we were one of the first clinics in the United States to open.
Wow. How amazing. I love that. I have to say again that use the word love in the sense of not just being open to it, but because I have had a lot of experience with other people here and also my own with psychedelics, I know the power of it. Yeah,
Hmm.
it can really change everything again. It opens the possibility for deeper healing. That's what I see has been my experience. Because some people are not able to go, not even conceive the idea of going into the healing process after, so much trauma. So there's something very compassionate about psychedelics when I think about it. So you mentioned opioids. Is ketamine also, I know some people get addicted to opioids. Do people get addicted to ketamine as well? Does it happen?
No, that's a good question. And ketamine is not addictive in the way that opioids or alcohol or nicotine are addictive. People don't form a physical dependency on them, on ketamine. They don't get
Right.
cravings, they don't have withdrawals. Now, some people can get dependent on it in the way that you could on ice cream or chocolate or sex. I
Yeah.
mean, people find things to use as a means of escape, and they may use it as a means of escape and kind of go gravitate towards that as that outlet for them, or the way that someone could use video games or TV where
Yeah.
they just want to,
Mm,
kind of check out. Um, but it is not an addictive drug, no, and it doesn't have any of the risks of really any of those other drugs. It's actually very, very safe.
yeah. That's wonderful to know, too, for those who don't know.
Mm.
And what are some of the misconceptions about ketamine?
Well, that's a big one that you just hit on for sure. Is that because some people do use it, recreationally or abuse it or however you want to
Yeah.
think of it, or self medicate with it.
Right.
Then people get worried. Oh, am I going to get addicted to it? Is this addictive? And the answer to that, as I just said, is no. It's not physical. You won't get physically dependent on it. Of course, if you're someone who has a substance use disorder, that's something to be mindful of and to speak
Mm,
with your doctor about, because it could be something that you decide to use as a means of escape, and of course that could potentially be problematic for you. But the answer of is it addictive is really no. In terms of in the clinical model, even less so than if somebody were to try it out on the street, because we have so many patients
yeah.
who come to us, and the experience is very varied. It can be spiritual, meditative, healing. It can be joyful. It can be
Yeah.
bring up sad or difficult emotions. But whatever comes up for people, none of them really say like, "Oh wow, like I could see why I want to do this all the time now." Like people even who enjoy it will say, I don't understand how people do this for fun. Like, well,
Mm,
who's doing this for recreation? Like I don't get it. That's a much more common response, even for someone who has a very like blissful experience of it,
yeah.
than anyone saying like, "Oh, I love this stuff and I want it." And it just people don't respond to it in that way. They could say this was like really meaningful or impactful for me, but I wouldn't want to do it in any other context. Like under the supervision of a doctor in a clinic like this feels right to me, but I can't imagine taking it at other places. So there's that one. I would say other things are, for the street use population, people who are doing 10 times the amount that we're providing
Yeah.
for years. Some have cystitis of the bladder. They have, irritability and bladder issues that result in that. About half of those people.
Wow.
So some people get worried that ketamine will cause that when it's used in a clinical way, and there's not really any correlation between the two. So again, they're doing like 10 times the amount for many years. And that's when it can start to cause things like interstitial cystitis and other bladder issues. Um, but what else? Some people say that it affects cognition. There's not really any real data for that,
Right.
especially again in the clinical therapeutic use of ketamine. So I would say that's another myth. I think those are the big ones. There's, with the recent death of the actor, Matthew Perry, a lot of people were saying that he died from ketamine or ketamine killed him. Well,
Oh,
he took more than 10 times the dose that we give in the clinic in combination with an opioid and a benzodiazepine while alone
oh,
in a hot tub, and he drowned. And he really died by drowning, and so it's very unfair to kind of categorize ketamine as the cause of his death, and it's just more
right.
than unfair, really. It's not accurate. And so a lot of people now unfortunately have this impression that ketamine killed the actor Matthew Perry. Again, all the circumstances I just mentioned really have absolutely nothing to do with the clinical use of it to treat mental health, which where again we're using a small fraction of the dose as well. And I would
Right.
also add that ketamine has a really large therapeutic index. So the amount of ketamine that you need to produce a therapeutic result and the amount of ketamine that would potentially kill someone is just absolutely enormous delta there. I mean, there's actually not any really known lethal amount of ketamine.
Mm,
It's very, very safe. You can take very high doses. Now, if you're in a jacuzzi or if you're flying a plane or you're driving a
yeah.
car, bad things can happen.
Right.
But if just the medicine itself isn't likely to cause a lot of harm, Whereas if you take something like fentanyl, an opioid,
Mm.
the amount of medicine that can actually help someone and the amount that can kill them is an extremely small margin of error. You hear about people, getting drugs, street drugs laced with fentanyl, that they have an amount that's less than the size of a grain of rice, and they
Wow.
die. So,
Wow.
that's one where you would, in contrast, say that the therapeutic index is actually extremely low. And again, that's the amount that can be helpful versus the amount that can kill. It's a very, very fine line
Wow.
with fentanyl. With ketamine, it's a massive spread. It's almost limitless. So again, a very safe medicine, especially when it's used responsibly. And just like with anything that can alter your perception or sedate you,
Yeah.
you need to be responsible with it, because if
True.
you're in a bad environment or an unsafe environment, bad things can happen.
Yes. Yeah. Thank you so much for the clarification, Sam.
Hmm.
Yes. Are there any side effects that you are aware of that has been reported over and over again?
Yeah, there's actually no known long-term side effects of ketamine for mental health. Short-term side effects are things like maybe nausea in around 20% of patients, which we can help with by
Okay.
giving medicine to them before, during, or after their infusion. It usually takes care of that. Some people get a little anxious. It's not really the ketamine
Uh-huh.
that's causing the anxiety. It's more the fear of the unknown. People are just nervous
Mm.
about doing something new or different. They don't know what to expect. So sometimes people do get a little anxious before. That's pretty natural and normal. I wouldn't even honestly categorize that as a side effect of ketamine in the same way that I would nausea. Feeling tired or fatigued is pretty common. A lot of people feel pretty, worn out after the infusion. They just want to go
Yeah.
home, rest, relax, take it easy. I'd say that's fairly common. I mean, during the infusion itself, dissociation
No.
is a dissociative anesthetic. It's got psychedelic properties, and I wouldn't really call that a side effect, though. I think that's a key part of the therapeutic benefit of
Mm.
it, and
Mm.
a primary effect, not a side effect. But that's something that happens during the infusion process.
Yeah.
Other than that, I mean, it's not a lot really. Sometimes people have a mild headache,
Yeah.
that day or the next day. It really is often due to dehydration, though. Not really the ketamine, because people don't eat or drink 4 hours prior to the infusion,
Mm.
and then if they're not eating or drinking much after, then some time has passed where they just haven't really been hydrating well. And frankly, a lot of people don't hydrate very well
In general.
ongoingly, anyways. So, but sometimes maybe the infusion can exacerbate that a little bit.
Oh, wow. Yeah, I love how much how informed you are. Of course, doing the work you're doing, it's firsthand, so you see everything that happens. That's wonderful. That was another question of mine. The process, what's the process like for those who are thinking about doing this? So again, it's this is in Los Angeles. I mean, I'm recording this in Florida, but this is your clinic is in
Right.
Los Angeles. So what are the steps? Like, I guess the question is the before, during, and after. Do you have protocol for all those stages?
Of course, yeah. So, as I mentioned, like before the infusion, people don't eat or drink for four
Yeah.
hours. We have them call, they get a free consultation. We explain everything over the phone, learn a little bit more about them, answer questions about what it is, how it works. They will fill out a form which allows us to speak with their other treating physician
Yeah.
or provider or their therapist. We'll chat with them about that person and their history, and then we'll do a more formal kind of medical consultation, which is also free. And that'll be an additional call with a provider, usually like our psychiatric nurse practitioner or psychiatrist, go over a little bit more of their background, make sure the treatment's an appropriate fit for them. And then we have them come in for their infusions. When they come in, they'll fill out some paperwork, some assessments, come back, have a brief physical exam. We have them connected to vitals monitoring for their blood pressure, pulse ox, EKG,
Yeah.
respiratory rates. So we cover all that, make sure that they're comfortable and safe the whole time. And then they sit in a recliner, which goes all the way flat, very comfortable, pillows, blankets, noise canceling headphones, relaxing music. We have lots and lots of albums. We also have a virtually unlimited selection because we have Spotify Premium and
Mm.
Apple Music and all that. So they can listen to pretty much anything. We really recommend music without lyrics. That's soothing, relaxing, calming, and not anything that's like aggressive or could be
Yeah.
distracting.
Mm.
And and then they wear a sleep mask and they recline and they have the experience. And our team is wonderful. I have a dozen people that I work with in the company who are all really committed to making sure that patients have a very comfortable and relaxing and
Yeah.
hopefully pleasurable experience. And so we monitor them and can adjust the dose of the infusion up or down if
Mm.
needed, if they want to go
Yeah.
deeper into the experience, or if it's a little bit much for them and they want to kind of take a little bit of the gas off, so to speak, we can do
Oh,
that
yeah.
too. So that's one of the benefits of the IV infusion, because some people are providing ketamine through other routes of administration, like IM injections, like a
Yeah.
shot into muscle, or
Yeah.
sublingual lozenge or troche or nasal spray, and with any and others as well. But those are the common ones. And with any of those, once you've given the medicine, it's gone. It's in the system. There's no way to
Right.
take it back or
Uh,
modulate it downward, at least. So um, you put a shot into the muscle or spray up the nose or something in the mouth. It's like the medicine's in the body already at that
right.
point. Whereas with an IV infusion, it's a continuous infusion for an hour, and we can actually increase or decrease that rate during the infusion. And the effects, the change, is felt very rapidly, which is one of the real advantages to ketamine, in comparison to other medications.
Yeah. Wow. That sounds like an interesting journey, which I have an idea what that's like. Is there also conversation, like your staff, do they talk to the patient during the treatment?
We don't usually talk during the treatment because we really don't want to distract them. We want
Mm.
to give them the space to have their own experience,
Yeah.
their own journey, and to kind of have an inner journey. If
Yes.
people need support or grounding, we can provide that. So helping them to feel more safe or comfortable, or be reassuring, it's definitely something that we can do. But generally, we give them space to have that journey.
Yeah, that makes a lot of sense. And then after, do you have integration, the process of integrating the information, what they have found during the session, or this is something that they have to do on their own? They have to find an integration coach or somebody.
Yeah, so we like to refer out for that. Our nursing team is great with, we call it more like debriefing, kind of after the experience, checking in with them about how they're feeling, what it was like.
Yeah.
We don't provide therapy at that time. I think of integration as more kind of in depth and
Yes. Yeah.
ongoing therapy after. And
Yeah.
so we refer out to that to licensed therapists, or a lot of people are already working with a therapist, and we encourage them to do
Mm.
that work with that person because they know them, they know their history, they know the issues that they're working on, and they can help to kind of tie that all into the experience that they've just had.
Yeah, that makes a lot of sense. Yes. Another question was about the how many infusions before the patient can start seeing improvements for whatever they came for? And
Mhm.
also, what's the max number of infusions? I have an idea because I read on your website, but I wanted the audience to know from you.
Yeah, you're asking really good questions. So the general protocol is a series of 6 infusions over 3 weeks. Each one is about an hour long.
Yeah.
That's the basic initial series or the induction phase. And some people will need 8 or 10 infusions, especially if they have really severe depression or they're really treatment resistant. We've been finding more and more people that actually
Yeah.
require more infusions to really have a breakthrough. But generally, not much more than 8 or 10. And most people will benefit from that 6. As far as when people start to feel better, though, this is again one of the
Yeah.
real great benefits of ketamine is it's usually very, very quickly. So generally by the third or fourth infusion, people are feeling much, much better. And the additional infusions kind of reinforce that and help to extend the benefit, ensure that it has some staying power.
Right.
So, within a week, anywhere from several days to 1 week, people are actually most of the time feeling really good, which is amazing in comparison to SSRIs or traditional antidepressant pills and medications that often
Yeah.
take 4 to 6 weeks to work, require playing around with different doses, different combinations. They have really undesirable side effects, and the quality of relief that they produce is really usually pretty mediocre.
Wow. Another question I have for you, but before that, I want to mention that I love that you have on your website, you have office manager. Banksy, I think is the name of your dog. I had a big smile on my face. Like, oh, this is a great manager. I'll
Yeah,
be
yeah,
probably healed right away. You're healing a lot of people with that alone.
yeah.
I
He's
just
laying
saw
down,
him. Yeah.
taking a nap right now next to me. He's on his
Yeah.
break. So he was a couple times when we were chatting. He was walking around in the background. You may have noticed him.
I saw him walking. Yeah, I didn't want to interrupt you to say that, but
Yeah,
I saw him. I have a dog too. I love animals. I mean, well, what's not to love about them?
yeah.
Another question is about the interaction with other medications and supplements. Is there
Hmm.
something to be aware of, or it's would be okay to use ketamine with anything else, any other
Yeah, I
medications?
mean, as a general rule of thumb, it's always important to talk to your physician or talk to one of our providers about all of the medications that you're taking so we can assess that, for each person. But generally speaking, there's not really any contraindications with ketamine.
Right.
There's no really negative or dangerous interactions. The one that stands out where there's a little bit of a potential for a problem is a drug called Lamictal. That's the brand name. The generic is
Oh,
lamotrigine. It's often used as a mood stabilizer, and in at least in regards to mental health. And just taking it, not taking it 6 hours in the proximity of 6 hours to the infusion to the start time, or 6 hours after is usually perfectly fine. As long
oh,
as you do that, that's usually what we would recommend. So abstain from it for 6 hours or more before your infusion, and the 6 hours after your infusion. Other than that one, we recommend that people try to minimize or also skip the dosing of their benzodiazepines. These are, anti-anxiety drugs that are fast acting,
yeah,
things like Xanax, Valium, any of these, fast acting anti-anxiety medications,
yeah,
um, lorazepam. These are things that are good to reduce or skip around the timing of the infusion because they can kind of blunt the response to the ketamine a little bit.
yeah,
They're not dangerous. They're not going to cause a problem. And in some cases, we actually give them to people during their infusions if they're really anxious, and they get a good benefit still. So it's not going to stop you from benefiting, but if you can minimize or skip it, it's better.
yeah,
Other than that, we don't really have any medications that are on our list of being dangerous.
yeah,
I think, if someone's taking a lot of other sedatives other than benzos or like opioids or something, I mean, that's, of course, that's going to be a consideration just in terms of us being aware of that. But, and like I mentioned at the beginning, we need to know all the meds that people are taking. And
yeah,
there might be something that could come up that could be potential concern, but generally speaking, there isn't.
yeah. That's also wonderful to know. Another question is about addiction. Do you get a lot of most of your patients, or some of them, with the addiction issues? Is that something that you have seen results, great result?
Yeah, ketamine can be really good for addiction, and a lot of people think that's weird because some people abuse ketamine. But
Yeah,
uh,
right.
if you have a ketamine habit, infusions are probably not a good treatment for you. But
Right,
for
right.
virtually any other substance, ketamine can be really good for alcohol use disorder, for cocaine dependence, for meth. I mean, for addiction to really just about
Yeah,
anything. And the reason is really twofold. One, ketamine can help to curb cravings. It can help with that, addressing that aspect of trying to abstain from a substance, and especially if somebody's involved in a treatment program of any kind, whether it's rehab or AA, or they're seeing
yeah.
someone for addiction counseling, they're already working on their sobriety, then ketamine can be a great tool to help to curb those cravings. And then also, most people who are
Mm,
using
yeah,
substances or abusing substances are doing so because they're self-medicating, because they're dealing with anxiety or PTSD or depression, and they're
right.
feeling terribly, and they're using drugs to try to cope. And so ketamine can be really powerful at getting at the source of the problem, at getting at those underlying conditions. So people are actually feeling better and functioning better, and they don't feel like they need these other drugs as a
Mm,
crutch. They're not as dependent on them just to function throughout their day. So ketamine can really help to treat the issue at the source.
yeah, that's also wonderful news. I see that on your website. You do have what is ketamine infusion therapy, which is good for. So you have you cite all the conditions: depression, anxiety, PTSD, addiction. You mentioned bipolar and unipolar. What is unipolar? That I didn't research that before talking to you.
It's basically just major depressive disorder, just
Oh,
your kind of standard depression.
yeah. Okay, so
Hmm.
that's it's really good for depression, from what I see. What are some of
Hmm.
the mental health conditions that ketamine is not good for?
It's not good for schizophrenia
Okay.
and other certain types of personality disorders.
Yeah.
Those are some contraindications.
Yeah.
It's not good for, like, it doesn't treat BPD or borderline personality disorder. It doesn't, if someone's, homicidal
Mm,
or really violent in that way,
yeah.
it's not likely to be really a good idea for that kind of a person.
Yeah.
Um, Other than that, it's really good for most. I'm not going to say all, but for most, we primarily treat people for depression, and as you pointed out, I mean, various forms of depression. So that's bipolar depression, and oh yeah, I would say that's another one that's not great. Is if someone's in the midst of being of a manic or hypomanic episode who's
Yeah.
bipolar, then we need to
Yeah.
wait until that subsides before we treat them. And it's really good for bipolar depression, but they have to be stable and they can't be manic or hypomanic. Then that's not a good timing to treat those types of people. Um, it's really good for postpartum depression as well.
Yeah.
Anxiety, PTSD, suicidality, those are the key conditions, the primary that we're treating. It can help also with OCD, but it doesn't work as well as it does for the others, but it can help.
Right.
And a variety of other mental health conditions as well, but those are the main ones.
Yes. What about women who are pregnant? Would they be a candidate for ketamine infusion therapy or not?
Yeah, so there's no evidence that's proving ketamine safety in that because you can't really do research on pregnant women
Yeah.
in that
Okay.
way.
Yeah.
But there's no indication that it would cause harm either.
Right.
Whereas, and I personally think it could be a good choice. It obviously is, really needs to be discussed on a case by case basis with
Right.
the, physician and the patient. And it really depends on how serious the situation is and what's going on. We know that SSRIs and other antidepressant medications do cause harm, have been shown to
Mm.
cause harm
Mm.
to unborn children. And so, if a mother is so severely depressed or otherwise suffering to the point where she needs a medical intervention or a drug intervention, I think ketamine could be a very good option. Um, Postpartum depression too can cause
Mm.
terrible
Yeah.
impact on not only the mother but the child and the whole family. And actually, suicide is the leading cause of death in the first year post delivery, which is something that I think is just really kind of mind boggling and isn't really
Right.
talked about very much.
Yeah.
And so, same thing in postpartum. Ketamine is fast acting, safe, effective. Ketamine is very safe in children. It's used in
Mm.
pediatrics for sedation over any other anesthetic because of how safe it is. So I think it's a really excellent option and should really be a first line treatment in those situations.
Yeah, wonderful to know. And I love that you added also children, teenagers, so that's good for everyone. Yes.
Hmm.
Another question I have for you, we're almost at the end. Gosh, Sam, and I have so many questions. So the other one is about you also offer psychiatric medication management
Yeah.
and transcranial magnetic stimulation. So talk to me about these two treatments that you also offer, because I see that on the first page of your website.
Yeah, so the first that you mentioned is just conventional psychiatry, general psychiatry, where we're managing people's prescriptions. We have a psychiatrist on staff, and we can
Yeah.
prescribe, whatever diagnose and evaluate patients, prescribe whatever it is that they may need. We do that through usually video visits, but sometimes in person, and we accept insurance for that service, so people are able
Mm,
to use
mm,
their insurance. So we're increasing, access to care that way. So we actually take 10 of the largest payers in California. So we can accept
wow.
most people's insurance. And the other one is transcranial magnetic stimulation or TMS.
Yeah.
And that's something we just launched recently, and it is using magnetic waves to stimulate parts of the brain that are underactive due to depression and other mood disorders. The treatment's currently, the machine we have at least, is currently FDA approved for depression, OCD, and for pain. There's a number of off-label protocols as well that are really effective for other conditions like anxiety, and others. But it's a very effective treatment. It's also covered by insurance. And so that's another thing that we added to help to provide more innovative solutions to help people with treatment resistant depression. And it's it's one of the things that's nice about that treatment is you don't get any of the side effects of prescription medication because it's very localized. So you're just stimulating
Right.
in the dorsolateral prefrontal cortex, which is like the front left part of the head of the brain. With externally, it's non-invasive, it's painless, it's quick, and it's just like a magnetic coil that's gently placed on top of the head, and it sends some magnetic waves, and it's like a tapping sensation.
Mm.
And there's no electricity, it's not shock therapy, it's not ECT, and it works really well. It works about 70% of the time. Now, ketamine infusions work 83% of the time in our clinic. So that's even more effective and faster acting, whereas TMS takes
Wow.
usually around like 2 or 3 weeks before people notice improvement, and ketamine's 2 or 3 days or 1 week. But ketamine's not covered by insurance, and TMS is. So
Yeah.
we added this
Huh.
to, again, increase people's access to treatments if they can't afford ketamine.
Wow. I love how you have expanded, you and your father expanded the treatments you offer just to cover, to help everyone. People who are not maybe a candidate or not willing to do ketamine, they can try something else. That's a beautiful commitment, Sam. Thank you so much.
Thank you. Yeah,
Yeah.
we got
Yeah.
tired of when people needed something else having to say sorry, like you can
Yeah.
maybe we can refer you to someone, and then they would say, oh, they have their wait is 2 months to see them, or I can't afford them, or
Yeah.
we have an 83% success rate with ketamine, but that still leaves about 17% of people who don't benefit.
Right.
And in the past we had to just say, sorry, maybe we can refer you to someone else who can provide a different treatment for you.
Yeah.
And also, people needed medication management. They needed help with their prescriptions. And we said, sorry, we don't do that, but we can send you to someone else. And again, same thing, oh, the wait is months to be seen. It's too expensive, this and that. Oh, the care is bad. They didn't take good care of me, whatever.
Yeah.
Hopefully, no one that we referred people to, they would say that about. But if they went and tried to find someone on their own, they might say, there's no one good. I can't find anyone good. So we decided, look, we're just going to bring it in house. We're going to do it ourselves, and then this way we can provide really comprehensive care, and we can meet people where they're at with whatever their needs are.
Yeah. That's wonderful. Thank you again. And
Yeah.
you mentioned insurance is not accepted for ketamine infusion
Right.
therapy. Do you wonder why? Have you asked that question? Is that has to do with the government? What's the impediment to that?
Yeah, so ketamine is a cheap generic drug. It's got low margins. The patent is up as well, so it's been around since the '60s, and
Yeah.
so multiple people make it rather inexpensively. The margin, the markup on it is low.
Yeah.
In order to have insurance companies don't like to write checks. They're in the business of aggregating money and profit. They're not in the business of keeping people healthy.
Right.
And
Mm.
in order to so the use of ketamine as an antidepressant is what's called an off-label use, and so
Yeah.
basically it was approved as an anesthetic, but using it for depression is off-label, and that just very, very common practice in the US. It just means that doctors have found it to be effective for something other than what it was originally approved for.
Right.
1 in 3 of all psychiatric medications are actually prescribed off-label, so it's very, very common. But with that, in order to get ketamine on label, approved by the FDA for this additional indication, it would cost tens or hundreds of millions of dollars and
Wow.
years of research. And no one's going to spend that money because they would never make it back.
Right.
So insurance says, oh, this is not an approved indication. It's off label. We don't want to pay for it. Not because it doesn't work, because they are always looking
Right.
for an excuse not to write a check. And Big Pharma is developing new drugs that they own wholly, name brand drugs with high margins, and those are the drugs that they want your doctor to prescribe and they want insurance to pay for. That's who they lobby the politicians. These are the drugs they lobby the politicians to support and get the laws and things in place for. They go and have their meetings and dinners and parties with their insurance friends and their doctors as well, saying this is the next greatest thing since sliced bread, and you guys need to be supporting it. So that's how healthcare works in the United States.
Yeah.
Yeah, though I'll tell you, it's starting to shift because we actually have a contract with Kaiser SoCal for ketamine infusions,
Yeah.
and that's a huge institution, and they're actually paying for ketamine for some of their members. Now, it is on a case by case basis, and it really is up to the psychiatrist at Kaiser to make that determination whether or not
Yeah.
they want to refer them to us. But they are sending a fair number of patients to us for IV infusions for mental health, which is a huge step forward. And I definitely applaud Kaiser for being more progressive in that way. And
Yeah.
as a health network, to be adding it is really huge progress. I think that the others will start to follow suit at some point,
Yeah.
but it's just a very slow moving process.
Yes. Like with any other process of changing systems, right? It takes
Yeah,
time.
yeah,
So you're almost at the end again, and I want to just mention as well that on your website you mentioned the healing potential of other psychedelics like MDMA and psilocybin. So and you're looking to integrate those two forms of psychedelics as well for healing. Do you have any idea when? Because psilocybin I heard is wonderful too. That's another way of healing mental health, especially.
yeah. We're excited to incorporate MDMA assisted psychotherapy as soon as it's approved. It'll probably be
Yeah,
approved in you know the third quarter, maybe the fourth quarter this year.
yeah,
Psilocybin is a lot of amazing research that's going on around it right now, and uh, I don't know exactly when that's going to be FDA approved. It'll probably be a couple years at least, but we're excited to bring those into the practice.
yeah. That's great news. I had to mention here, and I also want to mention what I read that I really love. What you say on your website, it says, the experienced and compassionate medical team is dedicated to patient safety and comfort with the reputation for anticipating patients' needs before they arise. So I guess the word here is compassionate. That's a huge plus, isn't it? I wish that every clinic or every hospital, they had that in mind as a value, compassion. We do need to see more of that because there's a lot of stigma when it comes to mental health, self stigma, and it's just so sad that to see that. I was looking at your staff, and I got that feeling like, oh my god, that's a wonderful. It almost feels like a spa, like a retreat type of place, not even a clinic. So that's wonderful. That's a beautiful piece there to add. The people that work with you, thank you for that too.
Yeah, absolutely. It's really we are a really tight knit team, and everyone who is with the company is just wonderful, and they really do care about the work that we're doing.
So I want to mention the website. So ketamineclinics.com, that's the website. It will be linked on the podcast notes, and it's located again in Los Angeles. So before we end the conversation for today, Sam, would you like to add anything that you left unsaid? Any question I didn't ask?
Yeah, I guess I would just say, first of all, that we offer free consultations,
Mm,
and anyone who's interested should go to our website, ketamineclinics.com, or just call us at 310-270-0625. And we're happy to speak with you, answer your questions, see if ketamine or any of our other treatments might be a good option for you. And it's confidential and there's no obligation, so do reach out if you're struggling with something. And the other thing I would add is
yeah,
that I just want to send a message to people that there's always hope. That a lot of people are out there feeling hopeless, and I want to reassure you that there is hope, and that we offer some of the latest innovations in treatment that you probably haven't tried, and if you've tried some, you probably haven't tried them all. Things like IV infusions of ketamine, transcranial magnetic stimulation, and there are other treatments that are soon to be available in offices like mine, such as MDMA, psilocybin, other psychedelics. And there's a lot of exciting advancements in the field of mental health treatment. So if you're someone who's tried a lot of things and not found relief or benefited, and maybe you've been dealing with this issue for 10, 20, 30 years, your whole life,
right.
I understand how you might feel hopeless about it. But I just want to tell you that that there is hope, and encourage you to continue to explore solutions.
Wow. Yeah, that's a beautiful message too. Ah, yes. Yeah. Thank you so much again. So before we say goodbye, I do ask a question to all my guests. So I'll ask you too, Sam. What three experiences you wish everyone to have before they lose the body, before they die?
I would say to fall in love and to be, deeply in love,
Yeah.
to connect with God, whatever you think he, she, or it is, to
Mm,
connect with a spiritual, powerful source of energy that's greater than you are and any other individual is.
mm,
And whatever that looks like, and whether that's a daily practice or it's a one off event or whatever, that you have that experience.
yeah.
And I would say also to have a sense of joy or excitement or accomplishment or
Mm.
a thrill of being alive that's so great that you don't want it to ever end.
Yes, I love that. Yes. Life, loving life. Yeah.
Yeah, really, really loving life. And I'd add a fourth one
Yeah.
in there and say, I think not everyone, I can't say this is actually something that I want everyone to have or that everyone should have, but I would say that if I'm going to add a fourth, I'd say most people
Yeah.
would benefit from having a psychedelic experience.
Mm,
And as a matter of fact,
mm,
I believe that a psychedelic, that the right one for the right person in the right circumstance can actually be really instrumental
mm.
in helping you to experience the other former three things I mentioned.
So true. Yes, a billion times to that truth. So thank
Yeah.
you so much again for sharing what you do as a professional, but also sharing timeless wisdom. So that's what I'm really interested in, anything that can connect us, in a deeper sense. So thank you so much for being open to that, yourself
Yeah.
as a human, and passing that on to us. Thank you, Sam. Oh, before we end, a question I didn't ask. Oh my gosh. Um, are you looking to expand your clinic from Los Angeles to other states, United States?
Yeah, initially we'd like to have other locations in California. Right now we have one. It's 5,000 feet, so it's a good
Yeah.
sized office, and it's very, it's beautiful, very serene. It doesn't feel like an
Mm,
office.
yeah.
Um, we are filling it up more with these new services that we've more recently added, and once we start to get a little bit more momentum there, we'll look to have other locations, and probably in California and then in other states as well.
Yeah, that's good news again. And I know it's a process, right? As
Yes.
always. Thank you so
Yeah.
much again, Sam. And we'll talk soon. Bye for now.
Thank you so
Thank
much.
you.
I really appreciate you and the
Bye.
opportunity and all of your really thoughtful questions.
Yeah, thank you.